Good afternoon, and thank you for joining us today. Today is Tuesday, September 7th, and on today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor for Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and Mayor Tom Barrett, we'll start with you today.
Well, thank you very much, Catherine. Good afternoon, everyone. Well, it's sort of a miserable day today, and fall is in the air. And I think we all recognize the period of time after Labor Day is marked by children returning to school, leaves changing, and temperatures beginning to drop. So as much as I love autumn, I always miss summer. But that also means as we enter this new season, we know that people will be increasingly gathering indoors. And this presents some challenges for us this year as it did last year. We all know that COVID-19 virus spreads more easily indoors than it does outdoors, which means we have to increase our vigilance and mitigation efforts, such as washing our hands, watching our distance, when possible, increasing ventilation, and yes, wearing our masks indoors, regardless of our vaccination status. That's because we know that layers of protection work in stopping the spread of COVID-19. And as I will be describing in just a minute or two, unfortunately, the numbers continue to trend in the wrong direction. But we also know one thing for sure, and that is that getting vaccinated truly is the best way to protect ourselves, our families, and our community as we begin to move back inside amid colder weather. So I'd like to now provide an update on our COVID-19 gating metrics. And unfortunately, as we've seen over the last few weeks, it's not a lot of great news. We remain in the extreme transmission category for COVID-19 cases per 100,000. We're now up to 272.5 per 100,000. And unfortunately, our percent positivity rate remains in the substantial transmission category, up to 9.8%. We don't want this to go any higher because this continues to be going in the wrong direction. We continue to remain at the highest value for our case burden since January of this year and are noting gradual increases. So in terms of vaccination, we know that we've made progress, but we also know we still have a tremendous amount of work to do. 53.9% of City of Milwaukee adults, individuals 16 or older, are fully vaccinated. And 59% of adults have received at least one dose. So we know that a lot of the people who are getting sick are people who have not been vaccinated, because even those individuals who do get sick after being vaccinated, by and large, are not nearly as sick as those who have been unvaccinated. So these numbers remain very concerning. We need to turn the tide and stop the spread of COVID-19 in our community. So as we do on a weekly basis, we're asking you to once again double down on this, to speak to a loved one, a family member or neighbor about the importance of getting vaccinated. We see over and over again, almost on a daily basis, people in hospitals who say, oh, I wish I would have gotten the vaccine. I wish I would have gotten the vaccine. And they're saying it from their hospital beds. I don't want to see that. I don't want anybody to see that. So share your experience and consider helping those individuals get a vaccination location at healthymke.com. We are all in the fight to crush COVID in Milwaukee together. So let's talk a little bit more about what's going on in the city. Summerfest is now in full swing, and proof of COVID-19 vaccination or a negative test result are required to attend the festival. And I think that that is a very, very responsible move by Summerfest, and I applaud Summerfest for taking that position. If you have lost your COVID-19 card, you can access the Wisconsin Immunization Registry to print your record. Again, if you have lost your COVID-19 card, go to the Wisconsin Immunization Registry to print your record. More information about how to access your record is available at milwaukee.gov/COVIDvax. City of Milwaukee employees can also use this resource to provide proof of vaccination as part of the city's vaccination requirements by the deadline of October 29th. Finally, this week, there are lots of great opportunities to get vaccinated around the city, especially if you're returning to campus for the start of classes. Right here in City Hall, the vaccination efforts started at 1 o'clock today. It will go to 3 o'clock. At UWM, at the Cambridge Commons Housing and Kenilworth Housing Building, that'll be from 3 to 7 p.m. tomorrow at UW Milwaukee Student Union from 10 a.m. to 2 p.m. and at Ascension All Saints Family Health Center from 1 to 4 p.m. Thursday, again, we'll be back at City Hall from 1 to 3, and Friday at UW Milwaukee Golda Meir Library from 3 to 7 p.m. Or call one of our health clinics or go to one of our health clinics or check with your provider. But please do everything you can to get the shot. And with that, I'm going to turn it over to County Executive David Crowley. Mr. County Executive.
Well, how are you doing, Mayor Baird? Thank you so much, Mayor Baird. I want to say good afternoon to everyone who is joining us, and I hope you all had a great Labor Day weekend and a safe one as well. So first, today, I want to recap the county vaccine policy that was issued last week for all of our Milwaukee County employees. And as we all know, increasing rates of vaccination in all eligible populations, it really protects the most vulnerable individuals in our community. Therefore, a vaccine mandate has been enacted for all Milwaukee County employees. And so current employees must submit required documentation verifying their complete vaccination status or a completed medical or religious exemption request. We need that form and all those forms no later than Friday, October 1st. And this policy, it does not immediately apply to county employees who are represented by public safety unions. Also effective October 1st, vaccination status or an approved accommodation will be a condition of employment for any current or future county posted positions, with the exception of new hires within the sheriff's office. All of our contractors who are working in county high-risk or congregate living facilities will be required to complete their vaccination no later than October 11th. And we're very early in the verification process, but to date, we've had more than 550 Milwaukee County employees submit their proof of vaccination. But also in the coming weeks, we're going to be hosting several information sessions, both with medical and public health experts, to really ensure that our diverse workforce has all the information that they need to feel comfortable making an informed decision about the vaccine. And these sessions will be small and tailored to the county's various department workforces. We're also working to ensure our managers are equipped with the information as well as resources to share with their employees, since they're going to be on the front lines communicating with staff. And departments may also require vaccinations for their contractors more broadly, and departments should consider the risk profiles of service users, our staffing levels, the necessity of the services being open for in-person use, and other operational needs while considering these broader requirements. But throughout the pandemic, we have made decisions and crafted policies that deliver on our vision of becoming the healthiest county in Wisconsin. And so this policy decision supports this vision, and we'll continue evaluating both the racial and gender impacts of this mandate across our workforce as we keep racial equity at the forefront of our pandemic response. But also with more employers, organizations, and events, as Mayor Baird was alluding to, are requiring proof of vaccination or a negative COVID-19 test, we've been seeing an uptick in the need for asymptomatic tests. And so I want to ask folks to really plan ahead and allow yourself several days if you're counting on a negative test result, so you're not inundating our local clinics or healthcare providers, as well as our pharmacies. So if you would like information on where you can find a testing site, please go to healthymke.com. Again, if you're looking for a testing site, please visit healthymke.com. And please remember that even with a negative test, we must continue to encourage mask wearing and physical distancing regardless of your vaccination status. And lastly, with the expiration of the eviction moratorium and the federal COVID-19 unemployment benefits, ending, I want to remind folks that rental assistance is still available. And so we know that eviction has been a major problem during the pandemic. And with colder months ahead of us, we want to make sure that people know where they can get help. So if you're looking for more information related to eviction prevention dollars that are available, please go to communityadvocates.net. Again, that's communityadvocates.net for more resources if you need assistance related to eviction prevention. Again, thank you for joining us this afternoon. And with that, I'd like to hand it over to Dr. Weston.
All right. Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 261 new cases per day and about 2 deaths per day. We also continue to see stable case rates as well as positivities. Now, hospitalizations and deaths do continue to rise. However, if cases remain stable, we would hope for and expect a plateau of hospitalizations as well. That usually follows by a couple of weeks, but we'll continue to watch that. We did see about a 10% increase week over week on vaccines, now with over 1,000 first doses per day. With more requirements for workplaces and events, we're seeing increased demand for testing. Now, as a brief reminder, there's two general types of tests that we often see. So first, there's the molecular or PCR test. And this is the more classic COVID test that we're all familiar with. It's the most accurate test. It's the most sensitive test to detect the virus. Now, in many cases, employers and other organizations requiring testing may specify the PCR test as the required type. Now, the main downside of this test is that it takes time to run, often with a turnaround time of a couple days. Now, the other common test is the antigen test, or often called the rapid tests. As they are called, these often result in just minutes. But they're not quite as sensitive as the PCR test, and they can miss the virus, particularly early or late in the infection. Now, that said, you can be very confident in a positive rapid test, maybe not quite as much in a negative. Now, tests are still widely available in our community. HealthyMKE.com is a one-stop shop for finding testing locations as well as vaccination locations. And you can sort testing locations by PCR versus rapid test as well on the website. Now, another topic to discuss, one that garners more controversy than many other issues, and that's the protection provided by COVID infection as compared to COVID vaccine. So there's been a large amount of research on this, and there's certainly some conflicting findings, which can make it confusing. Now, in trying to answer the question about natural immunity versus vaccine immunity, that is immunity from infection versus immunity from the vaccine, there's two main ways that we can evaluate the evidence available. So the first is to look at the immune response inside the body. And the second is to look at how that immune response works in the real world. So starting with the body's immune response, it's important to understand one part of the immune system that we often hear about, and that's antibodies. Now, we hear about antibodies as they're one of the easiest components to test for with a simple blood test. But it's important to remember that there's much more to our immune system than just antibodies. So think of antibodies as the bullets in your immune armory. So bullets are important, but so are tanks, bombers, missiles, warships. You don't want to go to war with just bullets. You want the whole arsenal. And when we study natural versus vaccine-induced immunity for those components of the immune system, we find often that people with natural immunity seem to have inconsistent immune responses. So while some people possess that entire arsenal of the immune protection, others lack a critical part, B cells. This is in the bone marrow. They're cells that maintain memory of the infection long-term to fight it down the line. Now, additionally, there seems to be an association between the severity of the infection, how sick you get, and how robust and long-lasting your immune response is. Now, in the end, the results are simply inconsistent as to whether natural infection develops the immune response necessary to sufficiently prevent infection. But we can also take the next step and look at how natural infection and vaccine-induced immunity play out in the real world. And here too, we see conflicting studies. So on the one hand, you have a study out of Kentucky, and this looked at residents of Kentucky and found that among those who'd previously been infected, the vaccine cut down their risk of reinfection more than twofold. Now, in contrast, there was a recent preprint study out of Israel that seemed to show that natural immunity may actually be more protective than vaccine-induced immunity. Now, importantly, that study is preprint. It hasn't been peer-reviewed yet, and it does contain some potential areas of bias, such as those who seek out vaccine may also be more likely to seek out testing and be found to be positive. And nonetheless, it's an interesting addition to the body of research. And a final twist to add to all this is the future ability for natural immunity versus vaccine immunity to fight against variants of the virus. Several studies have demonstrated that the targeted immunity provided by the vaccine actually works better against circulating variants than the more general immunity provided by infection with previous strains of COVID. So how do we wrap our heads around all this? Well, first, the scientific process is not always neat and tidy. And that's certainly the case here, but we can draw some clear conclusions. Sure, there is some conflicting research, but in general, it seems that there may be inconsistency in how robust immunity is obtained through natural infection. What many studies have demonstrated definitively is that the combination of natural infection and vaccine immunity, if you've gotten infected in the past, also getting vaccinated, that's the strongest protection of all. Now, given that we have a vaccine that's exceedingly studied and incredibly safe, it makes sense to recommend that everyone get vaccinated, regardless of past infection. And even if you've had a confirmed infection in the past, the vaccine will give you an added boost of protection and more consistency and reliability in your immunity now, as well as to future variants. And of course, there's no better time to get vaccinated than now, with the state program extended to get $100 for getting vaccinated. So make the choice, protect yourself, your family, and your community, and get your vaccine today. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As students head back to the classroom, it's important to be reminded of the safety measures we need to keep everyone healthy throughout this school year. The best way to keep our children healthy is to ensure they are up to date with their immunizations. Immunization appointments can be made at our Keenan Health Clinic on Fridays between 10 a.m. and 2 p.m., at Northwest Health Center on Wednesdays between 3 and 6 p.m., or the Southside Health Center on Tuesdays between 2 and 6 p.m. Children over the age of 12 can also receive their COVID-19 vaccine at any of our health centers. In addition to masking in schools and maintaining physical distance, the COVID-19 vaccine is the best way to reduce the spread of the virus. Everyone over the age of 12 should get vaccinated as soon as possible if they have not been already. Children under 12 are still ineligible for the COVID-19 vaccine, and the best way to keep our kids safe is to surround them by vaccinated adults. This includes parents, family members, teachers, daycare employees, and school staff. I want all of our students to have a safe and successful school year, but we must come together as a community for that to happen. Please get vaccinated to keep both yourself and our younger, vulnerable population safe. There isn't a better time than right now to get vaccinated. On Friday, Wisconsin DHS and Governor Evers announced an extension of their $100 COVID-19 vaccine reward program. Any Wisconsin resident who receives their first dose of COVID-19 vaccine at any vaccination site in Wisconsin, Michigan, or Minnesota through September 19th is eligible for a $100 US Bank Rewards card. All you have to do is fill out the form at 100.wisconsin.gov after receiving your shot, and you'll have your incentive mailed to you. The Milwaukee Health Department continues to administer COVID-19 vaccinations across the city. In addition to our mobile vaccination clinics scheduled this week that Mayor Barrett mentioned, the Northwest Health Center and the Southside Health Centers are open 5 days a week for walk-in vaccinations. No appointments are necessary. Effective today, the Milwaukee Health Department, health centers, and mobile clinics will only have the Pfizer vaccine available. Visit milwaukee.gov/COVIDvax for more vaccine information, locations, and hours. You can also visit healthymke.com for more information. There have been a lot of questions recently regarding booster doses of the COVID-19 vaccine. At this time, only those who are moderately to severely immunocompromised are eligible for an additional dose of the mRNA vaccine. We are still awaiting more information and guidance from the CDC and Wisconsin DHS regarding the booster for those who are not immunocompromised. As we get more information, we will share it on when and where you can receive a booster if and when it becomes available. Finally, September is Suicide Prevention Awareness Month. So I wanted to take a moment to talk about the importance of prioritizing your mental health. The ongoing stress, fear, grief, and uncertainty caused by the pandemic has weighed on many of us over the last 19 months. It's been incredibly difficult to navigate, and it's perfectly normal to feel the emotional effects of the pandemic. But it's also important to recognize the warning signs of a mental health crisis and what to do when you yourself feel, or if you see the signs in someone in your loved ones. We should be conscientious of behavioral changes such as increased alcohol or drug use, dramatic mood swings, withdrawal from loved ones, or aggressive and impulsive behavior, and know what to do in these situations. If you are experiencing feelings of hopelessness or suicidal thoughts, please reach out for help. You can call the National Suicide Hotline at 1-800-273-TALK, T-A-L-K, or you can text NAMI to 741-741, and it's NAMI, N-A-M-I. If you are uncomfortable talking on the phone, someone will be there to support you. There is always hope. Thank you.
Thank you, Commissioner Johnson. Our first question is for County Executive Crowley, and it comes from Vanessa Swales with Milwaukee Journal-Sentinel. She says, the county vaccine mandate mentioned people can request exemptions based on religious beliefs or medical conditions. How many employees have you received requests from, and how many employees do you expect or project who might be making that exemption request?
A great question. So when we think about how many employees in total, I'm not sure who's going to be making these types of requests, but we will make sure to keep you updated throughout this process. But to date, I think we've had about 80 Milwaukee County employees that have requested the exemption forms up until this point.
Thank you, County Executive. Our next question is from Ben Wagner with WISN 12. He says, with the uptick in the need for COVID-19 tests, is there any concern that could strain the system? Has there been any discussion in opening more or expanding current testing sites?
So I would say it's always something that we keep an eye on. If testing numbers continue to go up, we want to ensure that throughout the county, there's capacity for people to get testing easily, quickly, and for free. So I think at this point, the capacity is well matched to the testing sites that we have. But if testing continues to go up, it'll have to be a discussion.
I would concur with that.
Excellent. I see Brianna Johnson is looking for the website, so I will send that via chat. Brett Lemoyne with Fox 6 says, are there any local cases of the Mu variant, and how often are samples tested for this variant?
So I can speak to how often our samples being tested. A percentage of all samples are tested for all variants. So it's, I'm sorry, I don't remember off the top of my head the exact percentage, but we are testing for all variants. And I have not heard of any local cases of the Mu variant, but you can visit the Wisconsin State Lab of Hygiene website, and they have really great variant information online.
Thank you, Commissioner. Ben Wagner with WISN 12 says, a TV station in Green Bay is reporting more than a dozen cases of people overdosing on ivermectin there. Have Milwaukee County hospitals treated any patients taking ivermectin?
I've not heard specifically, but it's something we could look into.
All right, I'll give it just one more minute. Those are the questions in the chat for today, so we'll just see if there's any more. Otherwise, that would conclude our briefing. We will take questions related to Alderwoman Lewis at the end of the briefing. So just give it one more minute to see if there's any COVID-19 related questions. Otherwise, we'll get to your question, Ben, at the end.
Well, Catherine, let me just make this comment regarding Alderman Lewis. In preparation for this meeting, I obviously was looking at the issues related to COVID-19, so I have not had an opportunity yet to look at the criminal complaint that has been filed against Alderman Lewis. My understanding is that it contains some serious charges, and anytime you're talking about public trust, I take that very, very seriously and am very concerned about that. I'm also, I think as we all recognize, well aware of the fact that individuals are presumed innocent until proven guilty. So what I want to do is I want to take a look at the complaint and then decide what steps to take after that. So again, I would say it's a serious matter, and I certainly take it seriously.
Thank you, Mayor Barrett. Christine Hatfield with the Wisconsin Public Radio is wondering, there's been talk over the last month that Wisconsin can be headed in the direction of states like, say, Texas, as far as COVID case counts, hospitalizations, etc. Does it seem like we're still headed that way as far as Milwaukee at least goes?
Well, our numbers certainly look better than the numbers in Texas. I think we should be cautious, though, in comparing ourselves to other states. Wisconsin right now has about 54% of our population vaccinated. Texas has about 48% of their population vaccinated. We're not that far off from Texas in terms of vaccination rates. And that's what makes a huge difference to the case burden and disease burden that we're seeing. So we've certainly seen before times when Wisconsin's trending well and whatever state is trending poorly, and that can flip pretty quickly, and Wisconsin can trend poorly as well. So we need to remain cautious. We need to use every layer of protection that we can, the most important being vaccine.
Thank you, Dr. Weston. I believe those are all of the questions for today. So thank you all for joining us. Thank you, media, for the questions, and we'll see you all next week.
Thanks, everybody.
Thanks.
Thank you.